So you're a healthcare professional gearing up for the OET, and you know just how much is riding on it. Well, today we are going to pull back the curtain on one of the trickiest parts, the listening test. Let's demystify it together.
Look, we get it. This isn't just another exam. It's a huge step, a gateway to practicing your profession in an English-speaking country. The pressure can feel pretty intense, right? But having the right strategy is what turns that pressure into pure confidence. So, using the official OET guide as our foundation, we're going to break down the entire listening test piece by piece. The goal? To turn what feels like a major challenge into a clear, manageable path to success. First things first, let's get a lay of the land. You wouldn't go on a journey without a map, and you shouldn't go into this test without understanding its structure. Knowing the terrain is the first step to mastering it, and that all starts with a couple of key numbers. The whole thing is about 40 minutes long. And here's the kicker. You only hear each recording one time. That's it. No replays, so your ability to focus is absolutely everything. And in those 40 minutes, you're going to be tackling 42 questions. Now, those questions aren't just thrown at you randomly. They're split into 3 very distinct parts. Yep, 3 parts, A, B, and C. And each one is designed to test a totally different kind of listening skill. Understanding how they're different, well, that's crucial. That's the game plan. So let's dive into part A. Now, I want you to think of this section not as a test, but as something you literally do every single day, a patient consultation. Seriously, this part is built on skills you already have and use constantly. Here's the setup. You're going to listen to 2 different patient consultations. As you listen, you'll be filling in 12 gaps in the notes for each one. Sound familiar? It's exactly like taking a patient's history. You do this all the time.
And the notes themselves are going to look super familiar. They're structured just like real patient files, with headings you know by heart. Symptoms, history, treatment. Your job is to just listen for the exact words or short phrases to complete those notes.
Okay, lean in for this because it is the single most important tip for Part A. The answers you're looking for, they are almost always found in what the patient is saying. So tune out the professional for a second and really zero in on how the patient describes their symptoms in their own words. It's all about listening for those crucial details. All right, let's move on to Part B. If Part A was the quiet consultation room, think of Part B as the rest of the busy workplace. This is all about testing your listening skills in those quick, everyday professional interactions. For this part, you'll hear 6 short and sweet recordings, each about a minute long. They could be anything from a team briefing to a patient handover. After each one, you answer a single multiple-choice question. This section is all about fast comprehension. And the scenarios are going to be super varied, just like a real workday, you know? It could be a dentist talking about bookings, a surgeon chatting with a colleague, a nurse prepping a patient for a procedure. Your job is to quickly figure out the main point of the conversation. So, what's the secret sauce here? The strategy? You get 15 precious seconds before each recording starts. Use that time wisely. Read the question and figure out its focus. Are you listening for a purpose, a specific detail, an opinion? This preps your brain to snatch the answer right out of the air when you hear it. And now, Part C. This is the one that's widely seen as the most challenging part of the test. Here, we shift gears from those quick workplace chats to longer academic-style talks or interviews. Your job is to follow an expert's detailed argument from start to finish. You'll listen to 2 long audio extracts, each around 5 minutes. Think of a presentation on some new medical research, or maybe an in-depth interview with a specialist. For each of these long extracts, you'll have 6 multiple-choice questions to answer. This part really tests your ability to follow a sustained, complex piece of audio. It's a marathon, not a sprint. Let's put it into perspective. Part A is a practical back-and-forth dialogue. Part C, on the other hand, is more of a formal monologue or a structured interview. The language gets more academic, the structure is more complex, and honestly, it requires some real listening endurance. So how on earth do you navigate these long talks without getting lost? Well, here's a brilliant tip. If you're listening to an interview, use the interviewer's questions as signposts. Every time they ask a new question, it's a signal that the topic is shifting, and that's your cue to move on to the next question on your paper. Okay, we've officially broken down the entire test. We've mapped it out, but knowing the structure is really only half the battle. Your success on test day, a huge part of it comes down to your mindset. You have to remember, all that preparation you've been doing hasn't just built your knowledge, it's built your confidence. A calm, strategic approach is always going to beat last-minute panic. Trust the hard work you've already put in. So finally, on test day, keep these things in your head. First, think positively. Second, just concentrate on your own work. Don't worry about anyone else. Third, you don't have to get every single question right to pass. And last but not least, remember that you are probably doing much better than you realize in the moment. The OET isn't a barrier that's trying to stop you. It's an opportunity. It's your chance to officially demonstrate the incredible communication skills you already use every single day as a healthcare professional. So really, the only question left is, are you ready to go prove it